So go and turn that way. I'm going to try to stay out of the angle of the camera. Normally I would be standing right behind you like this, but just for the purpose so people can see on camera. I'm going to start out, let your arms dangle to your side. Just stand kind of how you would normally stand. Okay? Okay. So the first thing here to look at is the curve of the upper back. And there should be normally a little bit of a curve like that. And that's actually not too bad. It's actually a little flatter right there in the middle portion than it should be. This should be a little bit more of a smooth curve all the way around rather than big hinge point there, dip, and then another big hinge point there. And then coming down into the low back, back where we were last year, there's still a lot of arch there that if you remember kind of what we talked about, that rolling the pelvis under, that puts the low back in a better position. Now, if your low back's not in a good position, then everything else above that is going to have a follow-up effect, like a tower of blocks. So getting you started in the correct position from down there will help out with things. Now looking at just where the shoulder blades are sitting, can you look up towards the ceiling as far as you can? Okay, good, and relax, go back down, just straight ahead. Did you have any pain anywhere when doing that?
No.
So that's the 7th neck vertebrae going down in the upper back. Top of your shoulder blades normally sits right at about that 2nd thoracic or upper back vertebrae. And looking at where the top of the shoulder blade is there, it is right about at that level. On this side, notice it's up a little bit higher, which means there's more muscle tension up in these muscles back here on top of the shoulder where you're having the pain, holding that up. So if those muscles could learn to relax a little bit better, you wouldn't have as much pain or stiffness right there, more than likely. Now also the shoulder blades, they should be about 3 inches away from the spine. And kind of looking at where they are right here, that's significantly less than 3 inches, maybe 1.5 inches, 2 inches at best. Same thing with this side. That one actually is a little further out. So that's probably about appropriate. If we look down in the middle portion, they're both about okay there. Now if you look at the angle, this one kind of comes down and in, sort of on a diagonal. And this is more for the people at home. I wouldn't normally be explaining all of this to you right like this. This one is a little more straight up, a little more vertical, which is the way that things should be. Now if you picture that the shoulder blade is kind of like a triangle, this side sits down like that. That triangle is rotated down a little bit on this side versus the triangle is a little bit more in this type of position with a vertical center edge. Now where that comes into play is that as you reach behind you or as you do things overhead, that shoulder blade, it really, if it's tipped forward like that already, this one kind of lays straight up and down like that. This one's tipped forward and rotated down a little bit. As you go to reach behind you, that tips that down. And don't go too far. Don't go to the point where it's bothering you. Okay. That tips that forward even more. And what that does is it causes some tightness in the muscles up there. If you turn to the side and do that forward tipping as well, or do that reaching backwards again, you can also see it kind of puts some pressure on the front of the shoulder blade, on the front of the shoulder right there. The ball almost starts to move out forward in the socket. Now if we stay on this side view, taking a look at how things are lined up, you can see that there's the edge of the socket right there, where the shoulder socket is, and here's the ball. Now, the shoulder is a ball and socket joint. That ball should normally be centered right in the middle of the socket so that it can move efficiently. Now, yours is almost already forward a little bit. Now, go ahead and reach backwards behind you again, and you can see how that almost pushes the ball out even more forward in the socket, at the same time tipping the socket forward. So you're bringing the ball further in the socket and the socket closer down, which creates some pinching in the front of the shoulder. It also creates pulling on these muscles in the back of the shoulder that were stiff. So just changing that posture and that movement pattern, as well as getting the ball centered back in the socket, should make things a lot better. And we'll find out if that actually plays out to be true in a few minutes here. But can you turn around? And just to kind of get an assessment of where the other side is at, so
Oh, okay.
going that way. You look at the socket right here, there's the socket, there's the ball. Much more lined up, and it should be able to move much more comfortably. And from the sounds of it, you're not having any trouble with this one, are you?
No, no problem at all.
So yeah, those are coincident. Those are correlated. That this side seems to have some symptoms and seems to not be moving as well. This side moves or is aligned pretty well, and no symptoms. Is one the cause of the other? They could be. But we won't know that until we change something about it and see if that actually has an effect on the symptoms. So let's turn back to the other direction here. And can you raise both arms up over your head? Now, does that bother you at all to do that?
No,
Any pain, stiffness, anything that way?
no, that's good that way.
Okay, good. Come on back down. All the way back down. Any pain going down that way?
Yeah, right about in this area. I was okay up, but when I get down here, it hurts.
And that's a pretty common complaint for people with shoulder pain, is that it's harder to lower things, to bring something heavy down, especially if there's some weight in the arm, than it is to actually raise it up. Now, if I change something with your movement pattern here, and I'm just going to kind of support this shoulder blade on the way down. So raise up again. And I'm going to give you a little bit, and be honest here, don't just try to make it sound good because I'm your son and we're on video, but let me know honestly if this changes your symptoms at all, if you still get that catching, or whether it's any different, any better, or any worse. Okay, come on back down.
I do think it's better, but it's not completely gone.
Good. So that's one improvement. The other thing is that when your arm is more rotated like this, it brings the ball more forward in the socket. As your arm is more rotated like that, it brings the ball kind of more centered in the socket. So I'm not going to mess with your shoulder blade this time. Just want you to do the palm up that way and go over your head, go up over your head, and then come back down.
Yeah, that's where it clicks.
I heard the little catch right there. I doubt you could hear that on video.
There was a click, but there was no pain.
Okay. Then so I'm going to have you do your thumb up again. Let me kind of guide your shoulder. Also, if you keep your elbow just slightly in front of your body, that'll help bring the ball back in the socket, help tip the shoulder blade backwards more. Okay. So now we'll try from here. Go ahead and raise up again. Okay. And come back down. Hurt the click there. Yep.
But no pain, yeah.
So then tip back. Going to stabilize up here on the front and raise up again. Good. And then come back down.
Actually, that was good.
Got a little bit of a click.
A little click there.
But by holding the ball more, what do you feel there?
I feel pressure right there. Yeah.
Sore?
No, I think it's your grip.
Oh, it is my grip probably. Yeah. Okay, bring the elbow slightly in front of the body. We'll support right there. Keep the ball in the socket. Elbow forward just a little bit. Okay, and then raise up. Okay, good. And then come back down.
There was a tiny click. No pain, and just the tiniest of clicks.
Okay, let's try one more time just like that. Go up. That was a little too forward. Go like in the side angle right there. Okay. Support it there.
Not even a click that time.
Okay. So it seems to be a big issue of keeping that ball centered in the socket, which is the same when you go to reach behind you. Now, if we change with that reaching behind you movement, if we kind of do that same sort of measure of holding the ball in the socket, and what I want you to focus on doing as you're reaching behind you is not moving the arm back on the shoulder blade, but bringing the shoulder blade as a whole back around your trunk. Not necessarily twisting your trunk, but thinking about, if you let me show you, kind of bringing the whole shoulder blade back around. So instead of making it arm on shoulder blade, make it more of a shoulder blade on trunk movement, And then at some point, you will have to come back that way. But if you think about keeping the elbow at or in front of the plane of the shoulder blade and moving the shoulder blade more around, like when you're backing up to drive or when you're going to reach for your coffee, and making it more of a movement in that direction. Reach forward. And then reach back, kind of like you're going back to reach back to drive or reaching for your coffee cup. And I'm really having to hold you hard here to keep from popping out there.
I know, but it's not popping. Other than your grip, it feels pretty good.
So this is where we probably use some hands-on techniques to help get the ball more centered in the socket, make it easier for you to do that, because I can't walk around with you all day, every day, keeping your shoulder centered in the socket. So the movement pattern there would be, just to review, bringing the shoulder, squeezing the shoulder blade back, bringing the shoulder blade around, and keeping the elbow more forward right there. So bring the shoulder blade around. So twisting the drum. There you go.
Yeah.
Okay, and then come on back. Okay. Now, because those muscles are stiff up there too, we also notice that there's some more tone in that muscle. And does that feel stiff or sore? Or not too bad?
It feels tight, but I mean, you've got a strong grip.
Okay, let's twist to the side a little bit as compared to this side. Any difference?
That actually feels pretty good. It feels like a back massage. Yeah, no, that one hurts a little.
Okay. Now, how about we look at a different muscle here? Anything there?
No.
And anything there?
Not really, no.
Not too bad. Okay. Turn to the side. And chest muscles on this side. Any problems there?
No.
Chest muscles on this side.
No.
Any problems
Not
there?
really.
So essentially what we're looking for is muscles that are going to cause you to go more into that forward tilted position. Anything there?
Yes.
And that's is that the typical area where you get your pain, or is your pain in a different location than this?
Well, I feel pain there frequently, maybe not primarily, but yeah, that's an area where I do feel pain.
Where's your primary pain? You said top of the shoulder.
I think top of the shoulder, yeah.
So more in through there. Anything pressing around in the top of the shoulder, up there.
Yeah, right there.
Right there. Okay. Now that is actually, it's a muscle called your supraspinatus, which is a big long word, but it's the most commonly torn rotator cuff muscle, or the one that causes the most problems. Typically it does hurt when going up overhead and then lowering something down, especially when you have additional weight, or its attachment point is right there in the front of the shoulder, which is kind of what gets pinched when you go into that forward reaching position. So we'll do a couple of things manually to get the shoulder blade moving a little bit better, to get the ball centered back in the socket, and then to retrain you in some more normal movement patterns. So let's see how the best way to do this with camera. Can you lay down on your back so that your feet are that way and your head is more up this way?